learned this because I had a patient who was in excellent shape and a big CrossFit, and she came in, and at about a week, at her visit at a week, we changed the steri strips on the incision, and the whole incision was open. I mean, it had not healed. And lack of healing occurs for two basic reasons. One is infection, and the other is nutrition. And as a general surgeon, we learned all about surgical nutrition, but we don't necessarily apply it when we go into something like plastic surgery. So I just said to her, "What do you eat?" And she said, "Oh, I'm a vegan, and I eat, quinoa and lentils and blah, blah, blah." And I said, "You need to eat 2 eggs." She said, "But I'm a vegan." I said, "Look, your wound's not healing because you're malnourished. Eat 2 eggs." And she came back in a week, and she was totally healed. So I think that as part of what we need to do to have people protect themselves and heal as well as possible, I tell all my patients, I don't think you need supplements, right? I don't believe in food supplements. I want you to eat whole foods, and I want you to eat 2 eggs and 2 pieces of citrus a day. That gives you vitamin C. It gives you an additional amount of protein. And they say, "But I eat chicken, and chicken doesn't have enough protein." I mean, in order to get 80 grams of protein from chicken with 7 grams per ounce, how many ounces? You have to eat a pound of chicken a day. No one does that. A 4-ounce chicken cutlet is not adequate surgical protein. Okay, so I think that that kind of pre-operative explanation and supervision, because patients say, "Well, I did it, but really I have to keep doing it?" "Well, you're totally healed. You're only 3 days post-op." "Yeah, keep doing that."
Oh, I'm so glad you brought that up. And I didn't talk about that with anything else. I was on point. Like, I had my whole food, my mom, I'm like, "This is what I'm eating only for this time." And she was like, "Okay." They made me eggs every morning. Like,
right. See?
I was like, on it. And I haven't talked about that. I'm so glad you brought it up too, as a surgeon, because it is so important during that time, right? That is awesome.
Yes. Yeah. Yes, it absolutely is. Eating proper nutrition, eating well enough to heal a surgical wound is very important. And I think a lot of us, in the society in which we're never thin enough, a lot of us start depleted. So that's not a good thing. And it's another issue with massive weight loss patients, right? They have another whole nutritional situation going on too. So I always tell patients, now is not the time for you to be losing weight, right? I don't want you to be catabolic going into surgery. And I want you to prevent the post-surgical catabolism by eating well, right? I don't care what else you eat during the day, as long as you eat those 2 pieces of citrus and 2 eggs, right? And that's it. Yeah. Good.
So cool. All right. Let's see. Okay. So I want to hear your post-op instructions, how you deal with post-op, and then also your take on, so I ask every surgeon, why these repairs fail. Because I will tell you, in these first surgery groups, it is, I don't even know. It's bad.
Okay.
Like, there's a lot of crazy information going on there that, about why these things fail. And it's
okay. Yeah. So I will tell you that I am very strict about what you do post-operatively. And I will tell patients that it is, for a tummy tuck, I want them to take 2 weeks off of a desk type job. Okay. And I use the desk type job as a means to explain how much activity you can start doing in 2 weeks. At 2 weeks, you could get yourself to work, sit at your desk, get up to go use the restroom, go to the lunchroom, right? And go back home. That's what I expect you to do in 2 weeks. But during those first 2 weeks, for 3 days, you're going to need another human being to help you get in and out of bed. If you have children, you need somebody to take care of the kids, right? And if you have one person who's really good at taking care of the children and can still take care of you, that's great. Or you need to get a second person in there so that you're not tempted to say, "Oh my God, I really need to be," and so is in the bath with the, and I'm going to just do it myself.
Yep.
Because the biggest mistake I think patients can make, and I think surgeons sort of help them make this a lot, is to underestimate how much time they need. And if there's one thing that I do all the time during those frequent visits, in the first couple of weeks, is not just taking out the drains, but is making sure that the patient is taking care of themselves. Because no matter what I say, women overwork. They, they do things that don't really need to be done. But they think they need to be done. Right. And so, nobody really wipes down the kitchen the way I wipe down the kitchen. And I want to say, so what? Right. Nobody's going to die of having sticky countertops.
Right.
So you need to take care of yourself. So I tell them that I want, during those first 2 weeks, their big activity to be fixing themselves scrambled eggs and having moved from the bed to the kitchen to eat scrambled eggs to the sofa to fall asleep watching TV. I don't think that people need special equipment. I mean, I have had some patients whose friends said, you have to get this recliner. Yeah. Okay. Most of my patients are in and out of their regular bed, and I don't tell them that. We also live in a very hilly area. And so it is very, very common that, patients have 2 flights up to their front door. And, they say, can I do that? And I was like, yeah, slowly, but you can do it. You're not on bed rest. I'm not giving you, I don't want you using a bedpan. You're going to get up and move, but I don't want you focusing on tasks and forgetting what your body needs.
Yeah.
Okay. So at 2 weeks, you could expect to go back to a desk type job. And you can expect that if you do go back to that desk type job, that you will be in a position where, wait, excuse me one second, because somebody just kicked out really fast.
No
hey
problem.
Guys, hi, come on in. I'm just going to close my door, okay? Sorry, I'm back with you. You will be in a position that when you get home, you're going to be wiped. And you may not be in pain, but if you are used to doing, 4 hours of activity at night after everybody else is asleep, because that's your quiet time, you're going to be crawling into bed at 7:30 at night, exhausted. And the reason that happens is that you heal during sleep. And so when you're trying to heal a surgical wound, your sleep requirement is going to go up. Now, that's very frustrating to my women patients, who are usually like type A, and so I tell them to expect that for 6 weeks after the surgery, that for 6 weeks, they're going to be feeling better and better, but they're going to be exhausted. And they just need to give in to that, because it's almost like the body has a sleep bank, and you need X number of extra hours of sleep in order to heal well. And you can load that all up front and be really good to yourself and sleep during those 2 weeks and not distract yourself from what your body needs. Or you can spread it out and torture yourself for longer, because your body's going to take what it needs. So I will say, it's very typical that patients will come in somewhere at around 3 weeks after surgery for a post-operative visit. They'll sit down, I'll say, how are you feeling? And they start bawling. And I say, what's going on? And they say, I don't understand what's the matter with me. I don't feel right. I never should have done this to myself. And I don't laugh, because it wouldn't be nice to laugh, but I want to laugh because it's exactly what, and I say this to them in the consult, and they all still do this. And I say, sure, you're no longer in pain. You've forgotten your back already feels better. You've forgotten what you used to look like. This is now the new you. You're all done. As far as you're concerned, you're done. But you're really only 3 weeks into a 6-week process. And I promise you that the first day of week 7, you're going to start feeling back to yourself in terms of your physical energy. And until then, take a deep breath and just nap more. Okay, and just let it happen, because you have to. But I don't want my patients on the internet trying to figure out why they feel so tired.
Oh my God.
That's why I bring them back in.
Yeah,
right?
yeah. Okay. Well, I was at my parents' for 2 weeks later. I mean, I got up and moved and walked, but I was really trying to. I came back here week 3. I had a full-time nanny still, so I was at the house, but I wasn't doing much. I'd make myself maybe some food. I really and I just think that's so important to be away from the kids personally, because you said, you're like, oh, I gotta do, oh no, someone's not, like, it's too much.
Right.
Yeah.
Right.
Let it go. At least.
Yeah. Yeah. And the 2 significant wound complications that I've had in the past couple of years, One of them ran after her toddler on
Yeah.
postoperative day two.
It isn't.
Well, but also, you know, she ran after her toddler while her mother and her husband were in the room, right?
Yeah.
And her incision opened up,
Oh,
and the other one like carried her dog into the house because he was, you know, he weighs 30 pounds and he was in the
yeah.
backyard barking, and he was, you know, she was afraid that the neighbors were going to get annoyed and he wouldn't come in, so she carried him into the house. Like, he laid down on the ground and she picked him up 2 days post-op. You
Oh,
have to figure out that short of a fire in your house,
yeah.
you know,
Right.
you shouldn't be doing anything.
Right.
So
What's your like, do you do compression, no compression? What is
So that's a great question too. I actually was trained to do compression and we used to keep patients overnight in the hospital. And I walked in the morning and found that this compression is had rolled down, and we lost part of the skin of the abdominal wall. So I found that since I do these all ambulatory, that patients are really much more comfortable without compression. The garments are really uncomfortable. So if patients have swelling at about 2 weeks, I will have them go to Target and get like a Hanes or a Spanx, you know, a Hanes high-waisted panty or a Spanx. They're actually much better made than most of these surgical garments. They're much less expensive and they're much more comfortable for patients. It doesn't affect the overall outcome, but if patients are starting to feel uncomfortable with the swelling by the end of the day as they're getting up more, compression helps.
Okay, that's so interesting. Cool.
Yeah, but I don't do compression. I also don't do compression on my liposuction cases.
Oh,
You know,
okay.
so, you know, not initially.
Okay.
Not initially. Yeah.
And is there a concern? It's interesting because everybody's different on that too. So is it just that you feel like it doesn't do as much and it's just more
I think it makes patients uncomfortable, and I don't think that it's necessary. I don't think it affects the overall outcome. You know, there will be a time in a couple weeks when they've healed,
Yeah.
that compression is going to feel good as opposed to feeling bad.
Yeah.
But I can't imagine trying to get that big garment off every time you need to go pee. And I don't care how skilled you are, that little hole that they make in those garments, you can't pee around that.
It was rough. And and it was
yeah.
But okay, yeah, I'm so glad someone had actually mentioned to ask about that, which I'm glad because I want to get some of the different ways people do it out there. Okay, good.
Okay.
Okay, so it's 6 weeks. So you give your instructions. At 6 weeks, what's the plan from there? How do you guide people?
Well, it really depends on what they need.
Okay.
And one of the reasons that I see see everybody the day after surgery. That's when I get to see that they're taking care of their drains properly, that they're, you know, that all the questions that have come up in the first night are answered, that I'm making sure that they're eating, that we discuss their pain medication, because I'm very rigid about how I want patients to take their pain medication, certainly the night after surgery, because the same way, you know, women will jump up after their toddler, even with other adults in the room, women withhold pain medication from themselves. I don't know why. Yes. And so I take that out of their hands and I say, you're going to do this the night after surgery. And when you come in and see me the next day, we'll talk about, we'll liberalize that based on what you need. But I want you to get through that first night of surgery. And then I will, you know, for tummy tuck, I'll see them in a couple of days after that to take out the drains. And then a couple of days after that to take out the second drain. And then they might go, you know, then I'll usually see them at about a week so that I can make sure that they're standing up straight. Right. And then if everything's going perfectly, at that week, I change the steri strips, I put fresh ones back on. They can, you know, they're showering once the drains come out. And I will, you know, give them a set of instructions and see them again in a week. If there are no wound complications, we may then go to 2 weeks, right? I will usually see them before they get ready to go back to work, just to make sure that all their questions are answered. And we've reviewed again what they should or should not be doing, right? and at 6 weeks is usually when people come in and say, well, I'm